Georgetown Public Hospital Corporation has recorded less maternal deaths this year compared to the previous years. During a year-end press conference on Thursday, Head of the Obstetrics and Gynecology Department, Dr. Rafi Rozan, noted that there have been significant improvements in the treatment and care of patients in this department, which makes up 35 to 40% of the patient load at the hospital. He noted that this year there have been 7,285 obstetric admissions, which has seen a decrease since 2019.
We would have had 4,860 deliveries for this year, of which 1,569 were cesarean sections and 3,291 were spontaneous vaginal delivery. With regards to stillbirth, do note that the World Health Organization defines stillbirth as a baby who dies after 28 weeks of pregnancy, but before or during birth.
He noted that globally, there are an estimated 2 million stillbirths every year. However, in Guyana, there have been 54 this year, recording 11 for every 1,000 births. The Every Newborn Action Plan, ENAP, is a global initiative that is advocating for every country to have less than 20 stillbirths by 2030. Guyana is within that goal. This year, the number of recorded maternal deaths is 10 compared to 17 in 2021 and 16 in 2022.
In 2023, we would have had 10 maternal deaths. As compared from the two previous years, there would have been a decline, 7 of which are basically are direct deaths, and 2 of which are indirect and 1 yet to be classified. Direct obstetric deaths are basically caused because of the death due to a complication of pregnancy or a complication in childbirth, termination, or complication arising from its management. Whereas an indirect death is basically caused by the pregnancy interfering or worsening an existing condition.
Cesarean sections are now being done in a timely manner, taking approximately 10 to 15 minutes to get an emergency C-section case from the labor room to the operating theater.
With regards to these 10 maternal deaths in 2023, do note that 70% of these deaths were referred to Georgetown Public Hospital, and of these referrals, 6 of those referrals were deemed critical, and critical is being defined as the need for intensive care unit admission. So 6 of the 7 were basically critical, and 1 was deemed non-critical. 4 of the 6 that were critical came to the hospital intubated from the other hospitals that were referring. And do note that the referrals are not just from public hospitals, but also from private institutions as well.
The decline in the number of admissions and other improvements has been attributed to multiple strategies that were implemented in the department. The staff complement was increased at the outpatient clinic to facilitate the growing number of high-risk patients. In addition, from admission to discharge, a patient is seen by a specialist at all times. The department will soon add a specialist in urogynecology and a new unit for maternal fetal medicine to give special care to the severe maternal morbidity and life-threatening cases.